Okay, let's talk about misconceptions regarding ADHD medication and actually look at the research to figure out the long-term effects of stimulant medication without fear-mongering or glorifying any drugs. Starting off with by far one of the most popular misconceptions, ADHD drugs are literally meth. Well, the funny thing about this is that meth is actually an approved drug for ADHD, and it's the only drug I know of that has ever been approved for something without a study looking into its efficacy. But yeah, obviously this claim is more referring to first-line treatments for ADHD, of which there are two compounds that dominate the market: methylphenidate and amphetamine. Methamphetamine is a substituted amphetamine, but methylphenidate is completely unrelated to meth. However, in the case of amphetamine, compared to methamphetamine at equal potent doses, the two actually share quite a few similarities. And I have a video on this, but basically the summary is that so what? So what if it's an amphetamine? So what if its mechanisms are much like meth? That's not evidence of anything. In fact, low-dose methamphetamine has even shown neuroprotective effects in traumatic brain injury. The dose can both make a cure and a poison. Which brings us to our next misconception, that ADHD medications are toxic and will leave you off worse than you were before. And the reality is that it's much more nuanced than that, with stimulant treatment actually normalizing brain development in children, and evidence of long-lasting benefits caused by stimulant treatment, even when the stimulants are discontinued. However, there are primate studies showing concerning neurotoxicity at upper therapeutic doses, specifically relating to amphetamine, which is found in Vyvanse and Adderall. There's also some concerning observational data regarding the development of neurodegenerative disease later in life in individuals treated with stimulants, with some studies finding a several-fold increase in Parkinson's risk, and other studies finding that genetic variations in ADHD are not necessarily correlated to Parkinson's development. But we definitely need more data in this regard. However, when you look at the fact that ADHD youth are much more likely to develop depression, anxiety, binge eat, and a multitude of other conditions and behaviors that are harmful to their health, the limited evidence of stimulants posing a harm becomes largely overshadowed by the harms of not treating ADHD. But the first-line treatments for ADHD have been so for the past 20 to 30 years, and there's definitely a need to produce better ADHD medications. Oh, and since we talked about behaviors associated with ADHD, let's talk about our next misconception. Everyone shows symptoms of ADHD from time to time, and that the fact that ADHD is diagnosed only on symptoms makes it an illegitimate condition. So yes, while it is true that everyone can show symptoms of inattention, hyperactivity, and impulsiveness, and that most ADHD is diagnosed only on symptoms alone, oftentimes without any objective measurements, that doesn't mean that ADHD within of itself doesn't present with things that are unique to the condition. For example, ADHD is highly comorbid with restless leg syndrome, and while many people can relate to feeling inattentive from time to time, not many are going to relate to restless legs, irregular circadian rhythms, time misperception, and a weaker prefrontal cortex on an MRI scan.